welcome to another episode of the Live Today Show. And I'm Dr. Cherie, your host and founder of the Live Today Foundation, where our mission is to provide joy, inspiration, and free compression garments to under-resourced cancer patients and survivors living with lymphedema. I want to jump right on into today's programming and provide you guys again with some additional information on living with lymphedema. But before we jump right into the content, for those of you that may not be familiar with the Live Today website or the Live Today Foundation, I want you to go out to our website at www.live-today.org, where you can find invaluable information for patients, caregivers. There's information out there for individuals that are interested in volunteering with us. We were fortunate enough to receive a phone call from someone who has offered to come and work with us. Isn't that a blessing? She happens to also be a lymphedema patient. And so we're excited for the opportunity that we get to be a blessing to her. And then hopefully things work out. She'll get to be a blessing to us by continuing that legacy that even though she is living with lymphedema, she wants to do everything she can to prevent others from having to deal with the plight that we're living through now ourselves. So if you're interested in finding out more information about how you can be a volunteer, or just find out more about lymphedema and more about what the Live Today Foundation is doing, go out to our website at www.live-today.org. And for those of you who would have additional questions, or questions that would not necessarily be appropriate for our contact us form online, or if you know someone who is in need of compression garments, you can have them reach out to us and email us at info@live-today.org. You can always pick up the phone and give us a call at 754-220-0234. For those of you that are out there on social media, we want you to give us a holler. We want you to follow us on Facebook, Instagram, and Twitter at livetoday.org. That's livetoday, DOTORG. And subscribe to us on YouTube. That way you don't miss any of our episodes. And you'll also will be notified and made aware of when we have upcoming webinars, which we are excited about. So subscribe to us on YouTube. Just search for us at the Live Today Foundation. Now, like I stated, today I want to complete this 3-part series on living with lymphedema. It does require our attention, and I believe it warrants our attention to kind of go through what to expect, what lymphedema is, how to treat it, how to manage it, what it means to your life, questions to ask your physician and other clinicians. It just bears repeating, in my opinion, at least every 3 months or so, because we can tend to get complacent. And when you have both individuals in healthcare and outside of healthcare still referring to lymphedema as just some swelling, then I don't know if right now is definitely not the time to become complacent in thinking that everyone knows what lymphedema is, what it means to live with lymphedema, until it becomes commonplace and rolls off the tip of everyone's tongue who has been diagnosed with cancer and or treated for cancer, or every healthcare physician and other healthcare practitioner who treats cancer patients, until it becomes commonplace to talk about lymphedema and the risk of lymphedema and how to prevent chronic disabling lymphedema. I'm going to continue to shout to the mountaintops and repeat this information over and over and over again, because this does not have to be someone's life once they've been diagnosed with cancer. There is hope. Unlike when I was diagnosed, there is hope for individuals diagnosed that they can possibly live with never having to live with chronic disabling lymphedema. So let's jump right in living with lymphedema. Again, I told you before, a couple of episodes ago, that lymphedema can develop when there is damage to the lymphatic system or there's disruption in lymphatic drainage. Lymph fluid drains into the soft tissues. That's what causes the swelling. And this can happen anywhere in the body, but it most commonly affects the arms and legs. Things like cancer surgeries, radiation treatments, chemotherapy, and other medical conditions can raise the risk of lymphedema. Right now, 1 in 3 at-risk cancer patients will develop secondary lymphedema in their lifetime. So we can prevent this. It is most common, however, in women who have been treated, like myself, for breast cancer. So you may wonder, how do I manage lymphedema? I've gotten it. I wasn't part of a lymphedema prevention program. My physicians and or my healthcare institution never put me in a protocol to measure or monitor me for my risk of lymphedema. And now I look up and I'm 1 year later with one limb obviously bigger than the other. So how do I manage it? Well, while there is no cure for lymphedema, lifestyle changes can help you control your discomfort and reduce swelling. Exercising, practicing good hygiene, wearing the right clothing, and eating healthy can all help you feel better and in more control of your condition. So some general guidelines for exercise. Exercise is one of the best ways to keep fluid moving within the body. Always check with your physician before starting a new exercise program. Your therapist may have special exercises for you depending upon the stage of your condition. Lymphedema does develop in stages 0 to 3. Stages 0 and 1 are reversible. Those are the stages before you see visible swelling. Those are the stages that bioimpedance spectroscopy can detect by you stepping on that simple scale, that SOZO device, getting an LDEX score, measuring your total body fluid. And with measuring your total body fluid, we're able to detect when there is a shift and you're in those stages 0 and 1. And with that, we can intervene. We as physicians can intervene, get you into the proper treatment protocol, and then eliminate your risk of developing chronic lymphedema. And so there are the stages, but by the time you can see visible swelling, you are at stage 2, and then it is irreversible. And it does become a chronic condition that you will have to manage for the rest of your life. And so in addition to those special exercises that your therapist may recommend, depending upon your stages, you got to remember that you want to avoid strenuous exercises involving the affected limb unless you've been given clearance. You'll get specific instructions about the activities that are safe for you. To improve cardiovascular fitness, try some aerobic activities like walking and swimming and low impact aerobics, or specially prescribed exercises by your therapist. You want to aim for, 20 to 30 minutes most days of the week. I start off with exercising at the beginning of the day. I found out that for me, it just helps jumpstart my day. If I say I'm going to do it later, things just kind of get in the way. By the time I'm done with work or whatever I'm doing that day, I'm tired and it's like, So I make it part of my day. It really does. That cardiovascular activity really does help jumpstart you, get that adrenaline going. And then I can tell a significant difference. When I first wake up, look, let's say that morning I did not do my manual lymphatic drainage immediately, but instead I get up and I do my exercise. I do my aerobic activity. I can look at my hands and clearly see a difference between how swollen my hand was when I first woke up versus what it looks like after I've participated in cardiovascular activity. The swelling goes down significantly. And then when I add my manual lymphatic drainage on top of it, then I put my compression garment on top of it. Yes. Not perfect, but definitely better. You want to include a 5-minute warm up, and I would even say a 5-minute cool down with your exercise activity, including some stretching exercises. And again, if your normal exercise routine includes weightlifting with your arms or even strength training with your legs, you better check with your doctor or your therapist about the best time to resume this activity and ask if there are any weight or movement restrictions. For me, there were. I cannot get past 10 pounds with this extremity. Forget about it. When I do, I see the increase in swelling. And for me, although I would love to have nice, toned, fit arms, they're going to have to look the way they look because it's just not worth me exacerbating the swelling in my right arm. Now, stop exercising if it causes pain and discuss this with your physician. If your affected arm or leg becomes tired during exercise, cool down, rest it, and elevate it. As you resume exercise, you may want to make sure you slowly increase frequency and duration to allow your body the time to adjust to this increase in activity. What's really important is you really want to avoid infections by practicing good hygiene and skincare. So you want to keep your skin meticulously clean. Dry your skin thoroughly, including the creases and in between your fingers and your toes if your lymphedema is in your lower extremity. You want to apply lotion to the surrounding skin, but not in between your toes, because in between your toes and sweating is a breeding ground for bacteria. You get the slight little abrasion in there and poof, infection starts up. So don't put it in between your toes, but applying lotion to the surrounding skin is great. One, helps slide on that compression garment a little bit easier. But two, that moisture you will find will decrease that tightness that you feel in your skin. Applying lotion also keeps it such that when your hands move over your extremity, when it's not dry, it slides over more easily. If it's dry and creates fissures, those fissures can create a break in the skin, allowing for bacteria to easily enter. You want to frequently wash your hands with soap and water, especially before preparing food and after using the bathroom and or touching soiled linens and clothes. Again, this is to help decrease infections. You want to wear gloves while doing housework or gardening. Avoid cutting your cuticles. You know, when we're going for our manicures, you want to have them push those cuticles back. Fortunately, we know that it looks nicer when we cut the cuticles, but it won't look nice if it gets infected and it's all red and oozing with pus. So have them push those cuticles back. Don't cut the cuticles. And use care even when you're cutting your toenails. You don't want to cut back too close to the skin and to the nail bed. If you get athlete's foot, you're going to want to treat it with antifungal foot powder. Protect your skin from scratches and sores and burns and other irritations that might lead to an infection. A good way to make sure that it's protected is when you're wearing your compression garments. If you're bumping up against something that's hot or something that could rip, the first thing that's going to rip is the garment and not your skin. So your garments do become a protective measure for you. You want to use insect repellents to prevent bug bites. Always wear some sun protection when you're going outside, especially remember when you have been treated with radiation, that skin is exposed. So everything on my right side, my skin is more sensitive on the right than it is on the left. So don't forget that sun screen and protection, because you get a sunburn. Again, remember, as the skin begins to peel, now you have open areas for bacteria where infection can start. Immediately report any signs or symptoms of infection to your physician. That is pain, redness, oozing, it feels warm to the touch, or it has a smell to it. Got to report it to your physician. Treat minor injuries immediately. You're going to wash the area with soap and water, apply an antibiotic ointment, cover it with the bandage, and then call your physician. You want to avoid tight clothing, shoes, or jewelry. As much as I love my jewelry, I used to be one of those individuals. I had a ring on every finger, bracelets on both wrists. That was me. When lymphedema hit, no jewelry at all on my affected limb. You just don't. You may decrease that swelling with your manual lymphatic drainage and your exercise, and you say, this is a day I'm going to cheat. I'm not going to wear my compression garments. I'm looking pretty good. I got a nice little interview I'm going to, so I want to pizzazz myself up. I don't want to wear my sleeve and draw attention. Admittedly, I have days, I'm going to admit, I cheat too. So I get it. But don't cheat and call yourself thinking that you're going to put on a ring or a bracelet because you want to look good. But then when you get home after you've done all this activity, the swelling has returned. Can't get the ring off. Can't get the bracelet off. So I do have those moments, and I totally understand cheating on those days because you don't want to draw attention. But I would just caution you, I wouldn't put any jewelry on that affected limb at all. Just don't take any chances. And you want to make sure that you wear loose clothing that won't restrict your movement of your arms and your legs. You want to wear comfortable closed-toe shoes. Avoid tight hosiery and socks, except for your compression garments now. And if you have to wear watches or jewelry, be sure that they're worn loosely on the affected arm. I used to wear my watch on my right arm. I just now have gotten used to wearing it on the left. Sit properly. To keep fluid moving and flowing in your legs, try practicing good posture by keeping your feet flat on the floor and avoid crossing your legs. Try not to sit more than 30 minutes without getting up and taking a stretch and stand break. So get up, walk around for a little bit, for at least 1 to 2 minutes if you can. Stretch, move, bend down, do some stretching, walk to the restroom. So about every 30 minutes, you're going to want to do that, especially if you have lower extremity lymphedema. Consider wearing compression garments if traveling by plane. I always do. If you plan to fly in the near future, you got to ask your physician if you should wear a compression garment on your affected arm or leg to minimize swelling. For long flights, you may need to bring additional bandages. You want to be careful at medical checkups and blood draws. Ask that your blood pressure check be done on the unaffected arm. Avoid injections, IV lines, blood draws on the affected side whenever possible. I do. There's some schools that say, once you got lymphedema, it doesn't make a difference. It's not going to make it any worse to get your blood pressure or blood draws or place an IV in that affected extremity. I'm just on the other side. I disagree. I think any insult introduced into the affected limb could potentially cause an issue, whether or not you are introducing something that wasn't clean, and now I've set myself up for a greater risk of infection in that extremity, or just the actual insult of trying to get an IV started, it doesn't work, do it again and try doing it again in that affected limb. It's just why when you got other limbs to choose from. So I'm of the school of thought, avoid all of that. And to make matters worse, usually in your lymphedema affected extremity, the swelling has made it almost impossible to even find good veins to begin with. So why have somebody struggle trying to find them? It's going to make you uncomfortable, it's painful, it's stressful. So just go with the other limb. Eat healthy. Swelling is better controlled with good nutritional habits. Your lymph system works more effectively when there are better nutrients taken in from minimally processed, and you want natural foods like your fruits and vegetables and whole grains. Healthy eating keeps you closer to your ideal weight, which is an important factor in reducing symptoms. And it also makes you feel better overall. So you want to reduce foods that are high in salt and fat. You want to include at least 2 to 4 servings of fruits and 3 to 5 servings of vegetables in your daily meal plan. Eat a variety of foods to get all the nutrients you need. Use package label information to help you make the best selections for a healthy lifestyle. Eat foods high in fiber, such as whole grain breads and cereals, whole grain pasta, brown rice, fresh fruits and vegetables. Drink plenty of water. 8-ounce glasses of water are always recommended a day. Maintain your ideal body weight. A registered dietitian or your physician, clinician can help calculate your ideal body weight for this situation. Or you can go online and say, how do I measure my BMI? And you want to avoid alcoholic beverages. Take them, drink them in moderation. You don't have to completely take them out of your diet. Just use moderation. And the thing about maintaining your ideal body weight, obviously, as you gain weight, weight is going to go everywhere. We as women, especially, and the older we get, the less estrogen we have. We get weight gain, we get the flabby little arms and what have you. So imagine if you're gaining weight, you got the extra flabby arm and your arm is already swollen because of lymphedema. So you just want to be able to maintain your ideal body weight. Again, some people may ask, oh, with all of this, can lymphedema be treated? Yes. Can lymphedema be prevented? Yes. Now, there's no sure way to prevent all cases of lymphedema, but symptoms can be caught early and minimized. No matter the type or cause of your lymphedema, you can take steps to reduce or even prevent swelling. So I'm going to go over these, and then I may bounce back over to the website so you can see our lymphedema prevention program. If you have had breast cancer surgery, if you're worried about developing lymphedema, you got to talk to your surgeon and healthcare team about ways to head off symptoms early. For example, recent studies, and there is new testing out there, there is a new device out there that shows one, resistance exercises for your arms, working with resistance bands, light weights, push-ups may prevent symptoms. Soon after treatment, talk to your physician about having your arms measured at certain time intervals to check for changes in size. These checks can be done before you can see or feel any difference with swelling. Spotting these changes early can help you get started on a treatment right away. So let me repeat this. The question is, can lymphedema be prevented? Soon after your treatment, when you get diagnosed, talk to your breast surgeon immediately. What is your lymphedema prevention program? And where do I go to enroll, and how would I be followed? Because you're going to want to talk to them about having your arms measured at certain time intervals for these changes. Because these changes, when measured appropriately, they can indicate swelling before you ever visibly see them, which means they are detecting swelling in the reversible stages. So now let me see if I can share on our website. Let me see. I want to go to our website and show you where. Well, you know what? I won't share at this time. I'm going to stop. I won't share that at this time. I'm going to share at a later time, because I want you guys to, when I go back out to the website, I'm going to want you to see the Sozo device and what it looks like. But I'm going to repeat here. When you are newly diagnosed, you need to have baseline total body water measurements done. You want to be a part of a lymphedema prevention program, and you're going to want to have the affected limbs measured in certain time intervals in order to detect the early stages of lymphedema when it is still reversible. And that can be done with a simple bioimpedance spectroscopy device that measures your total body water. And it is a test, trigger, treat protocol. We test you every 3 months for the first 3 years, every 6 months for years 4 and 5, and annually after that. Trigger occurs when we see from your baseline to this significant trigger that indicates reversible lymphedema is trying to set in, and then we treat. Now your clinician will place you potentially in compression garments 12 hours a day for 4 weeks, and now we've reversed the onset of chronic lymphedema in your life. So now I want to continue sharing with you, again, living with lymphedema. If you want to find out more information about the Live Today Foundation, go out to www.live-today.org. You have someone who is in need of compression garments, shoot us an email at info@live-today.org. And you can always feel free to give us a call at 754-220-0234. If you're on social media, follow us on Facebook, Instagram, and Twitter at Live Today DOTORG. That's Live Today DOTORG. And subscribe to us on YouTube so that you can get first access to all of our episodes and the new webinar training that we are developing, and knowledge-based information we will be providing right there on YouTube. So just search for us using the Live Today Foundation. Now, let's go into lymphedema treatments and therapy. I mentioned in a previous show that your physicians may send you to a lymphedema therapist. Once swelling has reared its ugly head in your affected extremities, that's when your physician should be referring you to a physical therapist. If they do not, then you make the request for them to refer you. I mentioned that Some of the treatments can include compression garments like I'm wearing, multi-layer compression bandaging, as well as compression pneumatic devices. But there are other ways that you could work on to prevent symptoms. One, keep your affected arm and leg elevated above heart level whenever you can. Move around as much as possible to keep the fluid moving. Avoid exposing extreme hot and cold temperatures to your affected limbs. I've had this issue living through Chicago winters, can be difficult. If you've had radiation therapy, don't apply ice or heat to your arm or leg because this increases your risk of lymphedema. You want to protect the affected areas from sharp objects, so you want to wear protective clothing. Don't walk around barefoot outside if you have lymphedema in your lower extremities, or garden without gloves if you have if you have lymphedema affecting your upper extremities. You want to remember that use of electric shavers instead of scissors or razors to remove hair is the best way to go. And replace the shaver heads frequently. You want to always, as always, wear loose, comfortable clothing that you can move around in. And so what is the outlook for lymphedema? Though lymphedema isn't generally life-threatening, it is a lifelong condition, and controlling swelling and preventing infection in swollen areas is essential to good health. With the help of lymphedema specialists, you can better manage your symptoms. People have asked, is lymphedema dangerous or fatal? If you don't treat lymphedema, it can become dangerous to your health. If if swelling becomes unmanageable, you'll be more likely to get infections and other complications. Every infection can weaken your immune system and make you more vulnerable to life-threatening illnesses. Chronic and untreated lymphedema can also lead to a fatal condition called lymphangiosarcoma. Though it's very rare, this soft tissue cancer can also occur in women after double mastectomies. Signs of this condition are like blue, red, and purple markings on the skin that become ulcers and spread quickly. So again, I will stress to you, if your doctor or clinician or even someone in your family, you're just now noticing this swelling, you don't know what it is, but you hear others tell you, it's just some swelling. Thank God you're alive. You better run, get on the phone, call the right people. If your doctor is saying this, find another doctor. If your doctor doesn't know of your swelling, you need to call your doctor and tell them and ask if they have a lymphedema prevention program. If not, please refer me to a place that does. If you're sitting at home thinking, oh yeah, I noticed that, my right arm is a little bit bigger than my left arm, but it feels okay, and I'm done with my chemo, I'm done with radiation, and all things are all good. It should be fine. It's probably going to be fine. No, it's probably not. More than likely you have lymphedema. You can detect and see the swelling. You have chronic lymphedema, and it has to be properly managed, because if you don't treat it, it can become dangerous to your health. It is not simply just some swelling. The last thing you want to do is to get an infection that now takes over your systemic system. It spreads throughout your system. You become septic, a condition where it's all through your blood system. Septicemia leads to death. Lymphangiosarcoma is a bad way to go, and a bad thing to have when you have a condition that can be treated. And what about there is a condition that can now be prevented? Hear me. Chronic disabling lymphedema can now be prevented. So again, if you want to find out more information about a lymphedema prevention program, what to look for, how it's diagnosed, how it's treated, why I need to treat it, what happens if I don't treat it, go out to our website at live-today.org. further questions, you need compression garments, shoot us an email at live-today.org. Feel free to always give us a call at 754-220-0234. And if you're out there on social media, follow us on Facebook, Instagram, and Twitter at livetoday.org. That's livetoday.org. And subscribe to us on our YouTube channel. Search for the Live Today Foundation. That way you will not miss any of our new shows or any of the additional information that we will be sharing with you. I am Dr. Cherie, and I hope that this 3-part series on living with lymphedema and providing you with information on how to manage it, why it is important to have and understand the diagnosis, and this fantastic opportunity that you have if you have not been diagnosed with lymphedema, the opportunity that you have to prevent yourself from ever developing chronic disabling lymphedema. Please visit our website and find a provider that has a lymphedema prevention program using LDEX testing, using a SOZO device, so that you will not have to live with and change your life because you develop chronic lymphedema, such as myself. I'm Dr. Cherie, and again, like I stated, I hope this has been helpful. And I want you to remember to be present, take charge of your life, and live today and every day. Until next time, guys, stay cool, stay healthy, and be well.